Hello, moms. Hope you are doing well. Today, we are going to talk about another important topic for your baby. That is, importance of sleeping for your baby's growth and development. For healthy growth, little one needs three key factors. First one is loving, caring parents or caregivers who interact meaningfully with them. Then adequate nutrition, and the last one is adequate sleep. Throughout our life cycle, sleep plays an important role, but especially during the early ages, it's critically important when the brain develops faster. Having irregular sleep patterns are common in newborns. Sometimes they may awake at the midnight or they fall asleep late night. But as they grow, babies sleep throughout the night for long periods and have a more consistent daytime nap schedule. In general, babies sleep through the night nearly for 11 hours at 18 to 24 months and 2 to 3 naps hours during the day. What's the importance of sleeping for babies? There are few advantages of good sleeping for babies as I described below. It helps to release hormones that are important for growth and development. During deep sleep, this occurs, and some studies have found that children with low growth hormone levels sleep less deeply than the average child. It reduces obesity risks too. The risk of obesity is decreased by healthy sleep habits. Studies show that our ability to produce a hormone that signals us to stop eating when we are full may be impaired by lack of sleep. So it's important to have a good sleep to maintain a healthy figure. It increases attention span and learning. Attention span and learning are increased with a good sleep cycle. Research reveals that at age 6, children who did not get enough sleep during the first 3 years of life were more likely to show concentration difficulties and poorer cognitive output. It decreases behavioral problems. The same study on 6-year olds found that inadequate sleep contributed to hyperactivity and impulsivity during the early years. Even if children began to get more sleep, these results continued. Okay, now let's see the development of sleeping patterns. Infant sleep is irregular in the beginning. It's normal. Newborns feel hungry frequently, and the difference between night and day hasn't been worked out yet for them. In addition, they spend nearly half of their time asleep in active sleep, also known as rapid eye movement or REM sleep. They can move, twitch, make noise during active sleep, and wake up quickly. When baby mature, they spend less time on active sleep and more time on deep sleep, also known as non-rapid eye movement or NREM sleep. With longer nighttime periods and more predictable daytime naps, sleep habits begin to appear about 2 to 4 months of ages. Babies use nighttime to sleep more and daytime to sleep less, while they require an additional afternoon nap in their preschool ages. The evolution of sleeping patterns is not always a smooth process. When they begin to wake up more at the night and battle naps, several small ones go through sleep regression cycles. Here you can get a rough idea about your little one's sleeping schedule. What are the signs that your baby is not getting enough sleep? If they show below signs, usually they may need more rest than now. They turn away from stimulation, seems boring in their habitual environment, usually rub their eyes or pull their ears. Constant yawning, seems extremely fuzzy, irritable with feeding, and mostly cry louder. It is important to remember that these signs may be a bad result of something other than lack of sleep, and that may be interfered with baby's sleep, as example reflux. It's a good idea to contact your pediatrician if you have questions about your child's sleep.